We're talking about health and climate, the huge crisis we're facing, and how data science and data capacity building in particular can help. So let me go straight into the question. There is a growing awareness of the interrelation between the climate emergency and public health among both scientists and policymakers. To give you examples, the health impacts of increasing heat waves or the spread of climate-sensitive diseases. How can data science and data-driven technology help with both mitigation and adaptation strategies? And maybe I'll go first, Abhishek, to you.
Yeah, thank you, and it's indeed heartening. In fact, I joined the last session briefly, and it was so engaging to listen to what are the issues with regard to how data can be used for policy making. And when we look at the government, like the basic focus is that while we all say that we have data on multiple parameters, multiple departments, they are custodians of large amounts of data. But very often when we start using that data, we come up with the challenges which are there, how the data, even if it exists, becomes unusable. When we look at the specific question that you asked with regard to how data relating to climate change and data relating to how it can be correlated for addressing health concerns, then immediately certain thoughts come in, like especially if we look at the context of India and especially Delhi, then we always, like a few months from now, we'll start talking about pollution and how farm burning of the stubble burning in the neighboring states, it relates to changes in the weather, in the pollution levels, air quality in Delhi, how it impacts people suffering with asthma and other diseases, and also it's very often needs to be correlated with the wind movements, the weather movements. So all the data sources which are there, whether with regard to the crop cycle, with regard to stubble burning, with regard to the wind speed, with regard to the weather conditions, all of it relates to a particular environment happening which relates to air quality worsening. And once we have access to that data and then we look at the impact it creates on healthcare, we can think of evolving strategies to mitigate that. One way can be that stop this, stop that, but it might not be only one solution. And especially there are reports, especially when we look at the reports of air quality in Delhi, like how that is accentuated by the construction work that goes on, the vehicular pollution that goes on, and there are several factors that lead to doing that. So if we have access to the right data sources, and if we are able to build in models which would predict what parameter impacts the weather air quality in what manner, we'll be able to adopt mitigating strategies. So it becomes very, very important. So this just was one example, shows how the data with regard to climate, data with regard to air quality impacts healthcare. There can be many other examples similarly. If you look at global warming, if you look at the kind of temperatures which are rising over a period of time, in what ways it impacts the rainfall cycle, in what ways it impacts crop cycles, in what ways it might result in extreme heat waves, in what ways it can result in low agricultural productivity, they all become correlated. But what we need to do in order to be able to use these data sources and be able to use it for devising a strategies for healthcare and all, we need to build capacities in great levels. We need to, of course, think of how do we make whatever data is available, whichever authority, accessible, available, standard formats, index, searchable, usable through APIs, and that only then only various policymakers can actually leverage them and use it for our benefit.
Thank you so much. Same question to you, Professor Menon.
Thank you. I think actually one of the most important challenges which we have to really deal with is the fact that before mitigation and adaptation, we also need to understand about preparedness and response, because that is actually the key. If you look at climate change and also public health impacts, because we see that actually many of the things which we are actually talking about as neglected tropical diseases are all probably very closely related to the climate change which is happening, and especially climate change induced hydrometeorological disasters. We really need to understand data becomes really critical. And what is the data? Because we feel that actually the most vulnerable sections are actually the people in the global south, of climate change. And we need to really recognize that this is actually a problem which we need to really address straightforward, because if you really try and see that, we brush it under the carpet and then say that, it is a population in India and China, which is actually the largest emitters, I think there is some real difficulty in terms of comprehending that. So we need to really understand the demographic dividend in terms of the potential of converting that into an opportunity and not a liability. Because if you look at 600 million Indians, who are below the age of the median age of 28, that is actually an opportunity where, you can actually really build on, along with all the stakeholder groups, both civil society, the private sector, and also the academia and the universities. I think that's important.
100%. 100%. In fact, I'm going to skip a question because you've set it up so nicely and focus very much on this idea. India has just overtaken China in terms of the world's biggest population. India has the largest, by far, number of young people entering the workforce. This is related directly to your point. What supporting structures need to be in place from government, from philanthropy, academic institutions, private sector, to unlock that huge demographic potential? Unlock the potential of this generation to tackle climate and health, matching the scale of the problem with the scale of the skilled workforce we produce. I'll go with you first, please.
So, of course, we always, Professor also mentioned about the demographic dividend and whether we have overtaken China or not, but this situation we have had for a quite long time, that we have a huge population, we have a huge opportunity of skilling them appropriately, educating them appropriately, and ensuring that we are able to harness the demographic dividend. And therein the prime question comes in, that how do we ensure that our educational system and the skilling systems are so designed to ensure that people are ready for the jobs that will be created in the economy as we grow. And as we see the growing economy and the impact of technologies like artificial intelligence, data science and all, the more and more we start thinking of the need for upskilling, reskilling, changing the orientations. And one very key example that, in fact, last week I was in a discussion with the Ministry of Skills, and we're looking at the ITIs and the polytechnics that we have across the country in the tier 2, tier 3 cities, which train a lot of people to take not very high value but low value jobs in industry like the automotive industry. And they have courses on training people to become mechanics, fitters, automotive support teams in which people get jobs. But with the growing revolution of EV and the impact climate change is causing, and the more and more electric vehicles coming in, many of these vehicles will become obsolete, and if the vehicles are not there, these jobs will also become obsolete. So the intent that, so training people to take such jobs will not result in any good for us. So we need to think through what can be done there. So immediately the thought comes in, like if we look at the data economy, and if we look at leveraging the power of data, what very important work that will be required is a very simple core skill of data annotation. Like even if you have to tag X-ray images or crop disease images, you need somebody to actually take those images, tag it, do data annotation, do data tagging, and these are low value jobs, but you need to train somebody to do that. The immediate thought comes in, can we convert these automotive labs in ITIs and polytechnics to data labs and ensure that people are giving basic skills, and that will lead to creation of jobs in the tier 2, tier 3 cities. One such data lab was in fact set up last week in Nailet Center in East Delhi, and we were there to see that, and that's where the value will lie. But we need not one, we need thousands of such labs given our population scale. So we need to reorient ourselves towards ensuring that the educational or the training or the skilling programs that we learn in our colleges, our schools, our polytechnics are geared towards imparting these skills. And once we are able to do that, it's just an example, then we will be able to meet the requirements of the global economy and ensure that the population that we have, the number of graduates that we have producing are actually employable with the skills, with some job skills. So that's the strategy that we need to adopt in order to be able to benefit from the demographic dividend that we have.
No, thank you for that point. I mean, you mentioned data annotation. It's a big opportunity, but also a big discussion point. How do we increase the quality of the experience of those individuals so they have the support in the work that they do? Because often there is difficulty in how those jobs are structured to make sure that they're not extractive, but we give the value, the educational support to those people. So it's truly a job that they can grow in and have a career in. Same question to you, Professor Menon.
Thank you. Actually, I think, in many instances, we have been seeing one thing, that we are trying to solve today's problems with the solutions of yesterday. And that is very much relevant in the context of climate change and also public health. We need to really look at disruptive innovations, and that is where I think, the data science practice has to really become a part of education in the universities and also in engineering institutions and in ITIs and polytechnics. Because like what Abhishek ji said, we need to really understand that many of the jobs will become totally redundant. We have seen STD booths and PCOs, large numbers of people who were actually getting engaged in STD booths and PCOs a few years ago. But they're not there relevant anymore because, everybody is walking around with at least one or two mobile phones, okay? So we need to understand that employability is changing, income generation is changing, and also we need to really bring in incubators which can actually look at the possibility, like the startup ecosystem. We need to really look at a lot of data science, opportunities which are emerging, and also the cross-sectional interactions between disciplines, we need to really bring in. Because we have 1,200 universities in this country. Okay, and if you really look at these 1,200 universities and the multidisciplinary and transdisciplinary work which is possible, data really becomes the core, whether it is in earth sciences or whether it is in social sciences or humanities and arts, or whether we look at any discipline, we really need to look at what is the relevance of the data, what is the criticality of that data, which can save lives and also protect livelihoods. So I think the three key words which I would actually emphasize is prepare, respond, and recover. This is very much necessary in the field of climate change, and we need to really understand a lot of new emerging, diseases, vector, epidemiology is changing, and we see a lot of new diseases emerging, and whatever used to be, the endemic versus epidemic, that entire definition is actually changing. So whether it is Ebola or Zika or chikungunya or, the anthrax, which is actually also suddenly cropped up again in India. So we need to really understand that, these are all probably things which we need to confront as policy analysts, as data scientists, and also practitioners. We need to probably look into that.
I couldn't agree more. Datadog does a lot of work with the World Health Organization on epidemic preparedness and response from the data perspective. And one of the things we see is, after the pandemic, we have all, as communities, naturally, it's human reaction, relaxed, thinking the pandemic is over. But of course, the vectors that drive future pandemics haven't changed. They increase, and you mentioned some of them. Climate change is changing the natural extent of certain species, of mosquitoes, for example, that drive malaria, of other vectors of diseases. So that ongoing risk is still there. And data could be one of the tools in our toolbox to help predict and therefore prepare for this. So 100% agree. Because of time, I've skipped a question, as you probably realized. I'm going to go to the last question. What is your greatest hope for the future of data for social impact in India? And what is the #1 challenge we need to overcome to make that hope a reality? Abhishek, over to you.
Very interesting question. See, the reason that we have, like when we look at the context of India, whether it's data or whether it's required to any subject, by nature we are a very positive people. In spite of the extreme adversity that we might face as a culture, as a civilization, as a nation, we are always looking at the positive side of the things. So when it specifically comes to data, what excites me the most is that there's greater consensus across the stakeholder ecosystem, across government, industry, academia, non-profits, as also from the highest levels in the country. Our Honorable Prime Minister has been speaking about the data economy and about the need for being able to harness the potential of data. In fact, every time the National Data Governance Framework, which is being finalized, which will allow seamless sharing of data between government departments, as also sharing with the researchers and startups and entrepreneurs to take advantage of that kind of data. So that kind of push that we get from the highest levels. Now, the second important thing that has happened, of course, is with the digitization work that has happened in India in the last few years in almost all sectors, the digital public goods, the digital public infrastructure that we have built, and the kind of population, the diverse population that we have, the kind of data sets that we have access to in India is unique. We have different geographies, we have different agriculture climate zones. So in every sector, whether it's healthcare or agriculture, we have access to very quality data sets. The third important thing that we very important in India is that the amount of trained workforce that we have in India, which can play with that data, which can work with that data, the data analysts, the data engineers, the AI scientists, we are amongst one of the leading countries which such a strength that we have. So they can do that. Why we need to, of course, the fourth segment becomes the kind of compute that can be there to analyze that data, in which we are already making, as part of the national program on artificial intelligence, we are making a lot of investments in trying to provide compute infrastructure which can be used to analyze this data to come up with solutions, AI models which can help in building solutions for solving societal problems. So all that makes me very, very hopeful. And in the days to come, what I feel is that the combination of all these gives us a great opportunity for building solutions to address agricultural challenges, improving productivity, healthcare, making it more accessible, making it more affordable, making education more inclusive. So all these things are the positives that I see. But of course, it will require a lot of work and it will require joining of hands. And I'm sure initiatives like data.org, the India Accelerator Program and all will further push forward this agenda.
Thank you so much. Professor Menon.
Thank you. I think actually, the climate justice, gender justice, social justice, and social protection are all interrelated. And we need to really recognize that this whole question of justice and how data can actually help in sort of unblocking this whole system and understanding what are the real needs. I think that becomes really important. So I think, we would probably also need, my hope is that e-governance really integrates risk governance. Unfortunately, that risk governance part is missing in many of the institutionals' response, because actually as one of the founder members of the National Disaster Management Authority 18 years ago, I have actually been pushing for this whole question of open data in understanding the socioeconomic and demographic profiles disaggregated, age, sex, and also gender in terms of understanding. I just give you one instance. In Kerala, 25,000 transgender people were actually reported, in the official statistics of census of 2011. 25,000 people, transgender, identified. And it was also reported in one of the recent reports of the government of Kerala that at least 8,000 of them had attempted suicide once in their lifetime. This is something which we need to really understand. The whole question of social protection of vulnerable sections, of weaker sections, need to really be factored in. Whether it is a question of the COVID impact on the weaker sections, we've seen what actually people have gone through. I think this is very important. What is actually the levels of poverty? There is a recent World Bank report which just came out talking about poverty in India. I think, data has to be transparent, and open data must be really the right of the people. I think that is something very important. Thank you.
Such wonderful thoughts and words from both of you to finish on. Thank you so much.